Welcome to part 2, instability assessment of the shoulder.
Okay, so the left shoulder is the problem now, the right shoulder is fine. This is instability testing for anterior inferior instability, posterior instability, inferior instability, and AC joint. So first of all, we check for the AC joint, which is fine here. You know, it's at one level. So external rotation. This is an external rotation. This would be 90 degrees, so this is about 100 degrees. Same thing here. We check both sides, and also internal rotation in abduction. So this is ARO2 or IRO2. Okay, and then apprehension test. So you take the hand, you go into external rotation, and you push with your thumb from behind the humeral head, and with the other hand you hold your scapula. So this is positive if there is apprehension, not pain, apprehension. Okay? And this you do it at 90 degrees and 140. The jerk test is a little bit more difficult to perform. You hold the scapula, you compress, you do an actual compression of the humerus towards the scapula, and then you go backwards. And usually she has a little bit of a jerk test. Is it painful?
No.
Okay, so it's a little bit positive, but you always check both sides, of course. Then for anterior inferior instability, relocation test. You go into this position where the patient has the apprehension. You go a little bit backwards. You hold the scapula and the humerus. I can do it with my hands because I have quite big hands, but if you have small hands, you can do it in a laying position, like this, and then you ask them if they still have apprehension, and then the release test, the apprehension comes back if there is an anterior-inferior instability. Then you can check for the inferior capsule, which is the Gauge test. You hold the scapula, you abduct the arm. Usually it's about 90 to 100 degrees. 90 is normal. This is quite a lot because she's a little bit hyperlax, but it's symmetrical, okay?
If you liked the video, please hit like and follow me. Thanks a lot.